Hey everybody, Luke here again, and today we are talking more about neck pain and specifically arthritis associated with neck pain. So as you can tell by the title of the video or the blog, whatever you're looking at right now, this was a quote taken from a patient recently who said, "My doctor said I have arthritis in my neck and there's nothing I can do about it." And so I want to kind of tell you her story and tell you my response to that and how we actually approach people like this. So basically this gal, I had met her at a senior resource fair, this was a few months ago by now, and we got to talking about her neck pain. And she was kind of your classical person with real stiff neck, could barely move it, side to side, this way, that way. Had a lot of pain throughout her neck, up into her head, and then down into like her upper shoulders, which were real tight with her muscles and things like that. And so she had been to her doctor and had an x-ray, and on the x-ray you see things like arthritis, which is usually called things like degenerative joint disease, degenerative disc disease, and things like that. And as her doctor told her, she's just basically going to have to live with it, which I always kind of cringe a little bit when I hear people say, "Oh, so-and-so told me I just have to deal with it. This is just the way it is the rest of my life." Even though, it hurts me to read, look down and read a book, or to reach overhead, or to turn my head when I'm looking over my shoulder, things like that. So obviously she wasn't super receptive to the idea that I could potentially help her. So I said, "Okay, so what have you tried to relieve your neck pain?" And she said, "Well, I had a couple massages, and every time I have a massage, it feels really good." I said, "Oh, okay." So here on the one hand, you have basically this person telling me that there's nothing she can do about her pain because her doctor told her she couldn't. And over here, she says, "Well, gosh, when I do this, have a massage, I feel pretty good." So I said, "Okay, well, obviously, the truth is maybe somewhere in the middle there then." So basically there's 3 points that I kind of hit on with this gal ultimately as we were chatting a little more. And the first point, which is a little bit maybe surprising, is that your doctor is absolutely right. There's nothing you can do about arthritis. There's nothing you can do to change the fact that you have some structural wear and tear, and you now have some structural changes that will show up on an x-ray like degenerative joints and degenerative discs. Nothing we're going to do is going to change that. We can't turn back the clock on that stuff as much as we would love to. So yes, your doctor is right. You can't change your arthritis. Second key point though, which is to me a little more important than the first one, is that we don't need to change your arthritis to make you feel better. Let that sink in a little bit. We don't need to change the arthritis, the degenerative changes to make you feel better. Case in point with the massage therapist she had gone to, when you work on these muscles, I feel better, I loosen up a little bit, and I don't have as much pain. Great, that's the name of the game, right? You want to feel better and be able to do some activities that are bothering you right now, which again is different for everyone, but again, reading a book, reaching overhead, carrying things, whatever it may be. So third point then is that what we need to do to help someone like her feel better is we need to get her joints and her neck moving a little better. We need to get her more flexible so that it's more comfortable for her to do these motions. And then we need to make sure we can take as much of that tension out of the muscles as we can, which is going to involve several different treatment approaches and things like that. But at the end of the day, if we can get her neck to move more comfortably and we can get all that stress and tension to calm down, she's going to feel a lot better, and we will have done absolutely nothing to change her arthritis or any of those degenerative changes. So there you go. So that's the moral of the story. Even if you have an x-ray and you've been told by your healthcare provider or whoever, or a friend or whoever it may be, or your last physical therapist, that you can't do anything about it, just live with it. For most people, that's just not completely accurate. Now, are there some people that get to the point where they are having extreme pain and it's very difficult to treat? Of course. Doesn't mean you're going to get 100% symptom relief or anything like that. I'm not offering a magic pill or a magic wand or anything. I'm just saying for the average person with a stiff and sore neck, there's a lot you can do to reduce your pain, even if you have some of those structural changes. So again, if that sounds like you and you've been dealing with some of these things and you're just getting a little bit overwhelmed and feeling like you're kind of reaching the end of your options, just know that there are options. So if you have any more questions about what those options might be, or just want to chat about it, leave any questions or comments below the video. I'll leave my contact information there as well if you want to get in touch with me. So that's the message for today, and thank you for watching.